Welcome to the Startup Success Podcast with Bob Walsh and Patrick Foley. I'm Patrick Foley.
And I'm Bob Walsh.
In this, our 109th show, we talk with Daniel Kivatinos and Michael Nusimow, founders of drchrono. This podcast is all about helping startups succeed. Don't forget to make it a two-way conversation by following Bob Walsh and Patrick Foley on Twitter. Let us know what you think of the show and who you'd like us to interview next.
So today we have a follow-up to a show we did almost 2 years ago about startup medical practices and specifically about drchrono. And today we've got with us Daniel Kivatinos and Michael Nusimow, who are the founders of this software as a service startup. How are you guys today?
We're doing well.
Yeah, we're great. Thanks for having us back.
So what have you guys been doing for the last 2 years? Get back to work.
So yeah, we've been building product, acquiring users, and basically getting out there. Essentially, just really building product was that's our main goal, and really just making our end users happy, which are doctors and providers and physicians.
And it looks like you've made at least one pivot or two. Can you tell us over the last couple of years how have products gone in directions that you expected or didn't expect? Sure.
When we first started the company 2.5 years ago, me and Michael had gotten together, and it was kind of a meeting of the minds where we wanted to start the company. And I knew Michael was a very good developer. I knew him from college. We were college roommates. We kind of went our separate ways. Michael went on to Bloomberg of 7 years, and then I went on to go work at some startups. And really what had happened is we both decided we wanted to work on a company together several years later. And we got together, we started doing it. And our first idea was to have a really basic reminder and scheduling service for doctors to send to patients. So essentially a doctor could schedule a reminder to say, hey, Bob, you have an appointment at 5 p.m. This is just a reminder. So it could be a phone call, text message, or email reminder.
Right.
And really it wasn't enough to sell to doctors. So we had to make an immediate pivot, but it wasn't a total pivot. See, I don't like to use that word completely because we kept that technology there and kind of built on top of it at that point. Okay. We said, all right, this is not enough to sell. We need to build more. So some of the doctors that were using us, the initial beta users, were saying, you guys should do billing. I need a good billing provider to work with to send my medical claims through. So we thought it would be a broader scope of sales. So we started to build that, and we were building that for about a year, acquiring users very slowly. And through that process, we were kind of rethinking how we're going to really change the world. And around that time when we were rethinking this, we realized the iPad was coming out. And essentially, there's nothing really mobile in healthcare done right at the moment. So we really kind of just jumped right into it and made a bet. We said, Apple is on their game. They built the iPhone. They understand the mobile technology. So we're going to make a bet on the iPad. It wasn't even out at the time when we were deciding to do this. We essentially designed everything from scratch. For envisioning what the iPad's going to look like, work like. Mm-hmm. Mm-hmm. We downloaded Apple's SDK. They provided it to software developers even before the actual hardware was out. So we started to build out the actual iOS software, and we realized we were onto something because everybody we were showing it to, really, they just were saying, this is amazing, this is the future. I get it, I understand it, I want it, even before the software was out. And that was really a turning point in the company because we were presenting this to a few people and they were just loving the idea. So the moment the iPad came out, we were in the App Store. We were in the top 10 medical apps, right? Like the week after the iPad was released. And doctors essentially started coming to us in droves. And that was a turning point in the company where before then we were actually going out and finding the doctors. And at this point, the doctors were finding us.
Yeah, I want to go back a little bit. So it sounds like there's two key points in there that I see. One is, as you said, you didn't really like the term pivot, Because it
Right.
sounds more like you were focused on, you had a core set of value, but it wasn't quite enough. So you, more than changing direction, you were just building out value.
Right.
Continuing to add value to really to the same set of customers more than anything. And
That's
then,
yep.
okay, so then I guess the second, the real inflection point came. Is it fair to say that part of your success with iPad was in fact supporting it before it had even taken off? Do you think that was key to your success, as it was being that much of an early adopter, or do you not think that was key?
I think you're 100% right. I think it was actually very key. I mean, for us, we didn't realize we were actually building a mobile platform at the time. It kind of came organically. It was a very organic process for us. We built a medical billing engine. We had this reminder service, and it was just all there, but it was hard to sell. And then we realized mobile technology is just a really innovative field for doctors, and the iPad was our first bet. And we just kind of decided that's where we're going to focus on, and it worked for us. I don't know if you want to bring it, Michael, if you want to chime in for a second.
Sure. And yeah, I think that was a really big turning point in the company when we launched the iPad EHR product. That really got doctors interested in us. And just to follow up on your original question, I think the next big turning point following up on that, we just finished the winter 2011 session of Y Combinator. And one thing we did while we were in this session is really focus on how we can grow and scale our user base. And previously, we were selling a software product. We had a really great iPad product that doctors could use at the point of care, a really good back-end product they could use for scheduling and billing that we had built first. But it was still a paid product. Just like every other healthcare software company, we had a sales force, and they're going out and selling our product. And even this kind of violated the rules of the iPad App Store, because when you downloaded the app, it asked you for your information, and you became a sales lead, and one of our very friendly salespeople would call you. And that worked really well because it helped us make a lot of sales, but it didn't work kind of in the App Store framework. It was kind of breaking the rules because you expect in the App Store to download something and use it right away and get instant gratification. So a big pivot we made, or not to use the word pivot, but like a real just evolution of our business model, was to go with a freemium model. So while we're at Y Combinator and we're really looking to fuel our growth, we made the product free. So when you download the app from the App Store now, giving 3 or 4 pieces of information like your name, phone, and email, we'll create you an account instantly on our server and log you in immediately, and even populate the app with sample data so you could start playing around with it. And then the doctor, as they start adding patients and appointments and really using the EHR product and scheduling product, they can quickly just remove all the sample data. And I think that kind of followed. It was kind of very evolutionary, starting off from the point of wanting to. One thing about the healthcare space, I think we're one of the few innovative healthcare startups, because healthcare feels like a very old field. And this is just bringing kind of the modern software as a service and freemium models and App Store mobile technologies to healthcare that every other industry has kind of already adopted. If you look at Salesforce, what they did to CRM and enterprise software, I think this is, we're the first wave of healthcare startups that are really trying to bring that same revolution to healthcare. And I think that was just kind of following on from the iPad. And you could even see it. We have a user graph we showed off at YC's demo day, and we showed a lot of investors. And you'll just see a huge turning point where we released the iPad. It's, our user acquisition graph becomes a slope of 1 with really steady user growth, which is very healthy for a company that's making sales. And during Y Combinator, our user growth and our sales have just become exponential because we just had a feature in Newsday last week in their mobile iPad app, and it was great because a user can click on that and come find our app and download it and start using it right away. And even, all through the website as a turnkey process, buy our product and become a customer. And even we've really embraced the freemium model, because even these free users, our goal is to give away everything we possibly can for free to users on the free plan. And even using our free EHR product, a doctor will be eligible for $44,000 in government incentives through Medicare starting this September, just from using our free product. So they get a tremendous amount of value from using it, and they can actually use the iPad when they're treating patients. And it's just been a really good trip, and it's kind of evolved over, I think, the last 2 years. Those were the 2 really big turning points: launching the iPad and also going through Y Combinator, which was a phenomenal experience. But the biggest thing externally to come out of that was basically giving our product away for free on the low end and having paid upgrade plans.
Well, we'll come back to the money and Y Combinator in a moment, because I know our listeners want to know where this money is coming from, and also how did you get into Y Combinator. But not to make Patrick suffer too much, but what is it about the glorious iPad that finally broke the walnut of trying to get doctors to use modern electronic technology for records? People have been trying to break that into that market for 20 years, and they really haven't made a dent until maybe now. What is it about it that makes these doctors say yes rather than the no's they've been doing for so long?
I think the iPad is great for doctors, and actually one figure Apple released last year when they had the initial pre-orders for iPads, 10% of the 300,000 pre-orders in the US, that's about 30,000 iPads, were sold to physicians in the US. And that's a pretty significant chunk of that user base who's very interested in it. And I think doctors got the iPad right away. And it's ironic because they're normally the last people to care about technology, but they got the iPad right away, that it could replace their clipboard, that it's not as engaging as a keyboard. It doesn't distract when you're with the patient. And this is something I noticed when we first started the company that showed me how bad healthcare software is. I was in the doctor's office with my father, and he was seeing a specialist. He was quite ill at the time. And they had an EMR in this, it was a university medical center. And the doctor spent 20 minutes with his back turned to us as he was using some computer that's built into the wall. And I don't think in a 20-minute visit, he looked at me and my father once while he was treating us. He was kind of talking over his shoulder. And it just gave you a sinking feeling. And that's one reason EMR adoption is so low among doctors, is they realize that, I think they get it right away, that having a computer really takes away from that patient encounter. And there's something about the iPad, just the lack of a keyboard, which probably forces you to make user interface decisions to be less engaging, that they just saw this huge potential when interacting with patients. And it's shocking that no one else really got it that early. I think we saw the potential really early, and doctors got it too, but there's something about healthcare software. All these industry giants, these billion-dollar public companies, they kind of sell to the enterprise and hospitals mostly. Mm-hmm. They completely didn't see the iPad coming, and I think they're just realizing now that the iPad may be a good device for healthcare.
So you sell more to, solo practitioners rather than, Kaiser Permanente.
Yeah, our target market now are small 1 to 5 doctor practices, and that actually makes up 80% of the private practice healthcare market in the US. So it's a long tail of doctors who are really getting ignored by existing vendors who make a lot of money selling to hospitals, and they're very underserved. And the App Store is a great distribution model to get to them, because it can be very expensive to have a sales force kind of boots on the ground selling to them directly.
It's interesting that, there's this dichotomy between, I'm going to call it enterprise medical and the small and solo professionals. For a variety of reasons, I have been spending way too much time in medical places the last few days. And Patrick, Windows XP is never going to die. So there's that, but these people, this 30,000 doctors, really before they had a chance to see anybody's software, plunked down the money to get it. I mean, what's the motivation there? And maybe this is where we start talking about the 44,000 and where do I get my check?
I think just going back to the iPad for 1 second, I think there was more value just in the iPad itself.
Okay.
I mean, when we first bought our physical devices, the first iPads, we got them immediately when the first batch came out. I literally kept my iPad and it wasn't charged for about a month. And that right there is one of the key features. Mm-hmm. It's a feature.
Yeah.
to have this thing run for a month without having to charge it. And I was waiting for it to die. I was, letting the battery die down, and it took about a month. And that right there is really game changing. The price point was very low. It was around $500. Old tablets were around $3,000.
Yep.
Their battery life would last an hour, 2 hours.
And they're heavy.
And there's, they're just They weren't elegant. They weren't thin. They weren't light. Exactly.
Well, having written a couple of medical systems way back when, I mean, it's a database is kind of the answer for most of the stuff in terms of record keeping. What do you do with the iPad that you couldn't do with just, say, some other screen?
It's really a whole multimedia experience now. One of our focuses is to change the way that we think of a medical record. Now that the iPad 2 has a front-facing camera, we're going to be taking advantage of that.
Oh my God! You mean let me take a look at your sprained ankle and swelling and take the picture right there and then?
Right, and you could see the healing progress as the weeks go on. So you could say, okay, things are healing properly. So essentially, doctors can.
Oh, wait a minute. So if you end up with a user who has an iPad 2, or even just a cell phone that can take a picture, they can take a picture without even coming into the doctor's office.
That's exactly right. That's the vision we want.
That's game-changing for medical treatment. I mean, medical treatment is kind of a factory model, okay? You may come in for a tune-up or you may come in for a major overhaul, but it's not something that's done elsewhere than the hospital.
That's exactly right. I mean, the vision of healthcare that we have is you as a patient can essentially just download an app, click on I need to speak to a doctor now, immediately get an instant doctor, talk to that doctor. He could diagnose you or just give you some information.
I want to add one more thing to what we can do on the iPad we can't do on normal records, and slightly different from the multimedia aspects of taking photos and video, and we could securely update them to our website. But there's a few things we could do running natively on the app that, say, tablet-enabled websites and other things won't be able to do. And one example is real-time speech-to-text, which is a really great feature for doctors. I think the holy grail for doctors when they've been looking for health record systems has been a tablet form factor and something with speech-to-text that they could just speak into and not have to write down a lot or type a lot, and also something that they could very quickly jot notes on.
Let me ask a question about this money stuff. $44,000? Maybe $107,000? I mean, is there like now a ramp that you drive by the Capitol and they load up the back of the car with 10s and 50s? Well, what's going on there?
I could give you a quick overview of the government incentives. So there's two programs the government is running to help incentivize doctors to adopt electronic health records. And right now, looking at industry research studies, less than 7% of the 600,000 or so healthcare private practices have an EMR. That's an incredibly low number. And even less than 20% have any kind of EMR tool, like even just one piece of an EMR. So the government is really incentivizing doctors to start using EMRs, and they've set aside $27 billion.
$27 billion?
To incentivize them, in this very large program. It's part of the healthcare reform package. And for an individual doctor, just to $27 billion is an overwhelming number, but just to scale it down for an individual doctor, over the next few years, they'll be getting $44,000 if they're a Medicare biller, and they could get up to $63,000 or so for Medicaid billing, which is actually a smaller number of doctors. So the majority of doctors are looking to apply for that $44,000 as Medicare incentives.
It's good to know the sanity of our medical profession is still intact.
And and this year, if a doctor started using drchrono by the end of September, by September 30th, and they use it for 90 days in 2011, they'll get $11,000. It's the first tranche of incentives. And just to explain why the government is doing that, it's really to lower healthcare costs overall. And looking at the future of, there's something called meaningful use, which is what a doctor has to do to get these incentives. And EMR software like drchrono, we're getting certified by a government-approved third-party lab to be certified for meaningful use. And the government just wants to make sure, for the first time, doctors will have tools to, say, report on the health of their patient population and report metrics to Medicare. And the government will be able to use a lot of these metrics in the future once every doctor's plugged in and reporting these metrics and has the technical ability to do it, to really look at, the health of the Medicare and Medicaid population and pass policy? Do we need more doctors? Do we need, what are the real cost centers for these programs? And in small pilot programs, they've always proven when you're able to analyze this data that you could do some really common sense things and react to that data to really lower healthcare costs. So overall, the government is really looking to, healthcare reform is one of the biggest topics in the country right now. And this is a part of the technology solution, being able to analyze and crunch all of this data, which is now, in fact, all of your clinical data, because less than 7% of doctors using EMRs, all of that clinical data is in paper. And I know whenever I go to my doctor, my family doctors and the doctors my family goes to, all of the clinical records are on paper. And there's no way the government can mine all of that paper data. So the ability to have it all electronic in a government database and analyze that data will give the government amazing ability to do things it never did before. Like, look at numbers. Are there enough doctors in the U.S.? Are there enough nurse practitioners? And
which treatments have the best outcomes? Which treatments don't have a good outcome? About 10 years ago, I remember coming across a statistic that I thought was mind-boggling then, and that was that something like 10% of the $666 billion spent on healthcare in the United States, 10% of it was just for paper record keeping, which is a god-awful lot of money. And I can only think that number has gone up in terms of maybe the same percentage, but just the healthcare now is a lot more expensive than it was 10 years ago. I'm curious, though. I guess I'm surprised because it sounds to me like you're saying the motivation that the government has for giving these incentive payments, and I think they also start whacking them with penalties after a while, too, if they don't start doing this, is they want to get at the data. It's not so that it's easier on the insurance companies or that you can interoperate records between different doctors and institutions. They want to get at the data. And I find that kind of interesting in and by itself.
Yeah, I think you're right about the other cost-saving factors as far as, cutting down that 10% that's spent on paper records. The ability to transfer health data between hospitals and doctors should cut down on redundant testing. And, if you go to your hospital that's not your normal hospital, they may not have to redo an x-ray or an MRI if they have your health record. So those benefits, I think people see right away. Those are the immediate benefits. But the ability to analyze data would be a huge win over the long run.
So healthcare is a heavily regulated industry. And how do you, two-part question, how do you provide a solution that allows doctors to be compliant with HIPAA regulations? And then how do you give doctors confidence that your solution will allow them to remain compliant with HIPAA regulations?
So we're working with a government-sanctioned lab called InfoGuard. So this is an independent third party that was certified by the government to certify healthcare IT systems and electronic medical record systems like drchrono. So we're currently working with them to get certified. So they will inspect all of our security protocols and encryption standards and also our functionality to make sure that we have all of the features required for a doctor to get reimbursed for this $44,000 from the government. So in our industry, there are these third-party labs that will certify us, and the government has set it up that way. And it's both good and bad for startups. The cost of getting certified is in the tens of thousands of dollars, which could be a barrier of entry for a lot of brand new startups. Right. But it also allows a small company like us to compete with much larger companies because they can't get any certification higher than we can get. Once we get all of our features certified, we could claim, our features on this iPad, it's not a toy. We got certified by this lab, and it helps a startup punch above its weight grade in a sense. In that we could say, our system is certified and is just as good on this back-end stuff as a larger system, and the UI and front end is a heck of a lot better, as you can see, like, being on the iPad and, taking into account design and not worrying about enterprise kind of concerns.
Two things that you're doing in marketing drchrono I thought was worth asking about. One is I see you have a live daily demo. How come? How are you doing it? What are you using to make that happen?
So we use GoTo Training to do a daily demo, and I believe we do it every day except Sunday, so Monday through Saturday. Uh-huh. And our head of sales, Caitlin, will run that demo normally every day. And it's a great way to train new users who just downloaded the iPad app, or a lot of users don't even have an iPad, but they want to see the electronic health record system on the iPad in action. So using GoTo Training, Caitlin will share her desktop and run an iPad emulator, a simulator, which is the same thing we use to develop the product, and can actually show them how the iPad application functions and how it ties together through drchrono.com for the scheduling and billing and how they're integrated. And it's a great way to train new users and also help spur sales and help get free users using the product more and getting them to upgrade for paid features like speech to text and medical billing, which is where we generate all of our revenue from.
Okay. The other thing I noticed is that there is a lot of video out there, especially on YouTube, of you showing how this stuff works. And it's not just, demo videos. You've also gotten some really nice press coverage, NPR for one. How are you getting these people to talk to you and, get you into the story?
I'll take this one, Michael. So really, I guess it's right place at right time. Part of it is because we're in healthcare. Part of it is because we're in technology. Part of it is because we're building things that people are interested in. But another key element is just getting out there and always being out there. So when a reporter wants to do an interview, we're more than willing to talk to them. We keep our company open. I see that as one of the keys to being a successful company is essentially just telling people about who you are, telling them what you're doing, telling them what you're building. It gives you a very open culture, which I think is very healthy, at least in what the companies are doing today. A lot of the companies who are very open are very successful. So really just when an opportunity arises, we generally just jump on it and say, let's do it. Yeah, I mean, that's pretty much that simple. I don't know if you want to jump in, Michael.
I would say being in stealth mode is something we never considered. So as we're working on the product and working on new features and striking up partnerships, I think we're really public about that, what we're working on and what we're just about to release. And I worked on 2 startups previously that were not as successful as drchrono, and the big difference I saw there was both were in stealth mode and had trouble launching out of it. So I think that's one thing for a startup-specific audience, that we're the complete opposite, the antithesis of being in stealth mode. We're very public. We're always really trying to get a lot of exposure for our features to get people to care. And I think we're lucky in the sense that the iPad is kind of a big story and a big change in technology. And healthcare reform is also a big story, and we're kind of at the intersection of those 2 big points. And that's, I think, makes us very press-friendly and interesting to people who care about either or both topics.
Fair enough. And another kind of press-friendly area of interest to startups is Y Combinator and similar kinds of incubators. Can you tell us a little bit about how you got into Y Combinator, or what kind of advice would you give to other startups looking to get into that program?
I'll start off talking about the Y Combinator experience. So first, I would say Y Combinator is probably the best experience of my life, and definitely the best thing that ever happened to our company, drchrono. And I would encourage everyone to just apply and do their best in the application process. And even a great way to kind of get insight into the application process is to talk to alumni from the program. There's a lot of very public alumni, and one of the alumni is Convor, and there's a Convor chat room where you could go and talk to alumni and kind of connect with companies. And it's a really great process. And I think we learned so much during the process, and it really just helped us change the company. As I mentioned, the freemium model was really inspired by working at Y Combinator and Paul Graham looking at our company. And he told us 2 things that were very blunt. He's like, 1, you have to grow your user base really, really fast, exponentially, and change your company to do that. And 2, he told us our product was ugly. And we're always really quite proud of it. But when someone like that gives you advice, we hold him in such high esteem. And we had a full-time designer, and we hadn't really turned his skills on our iPad release. And actually, this week we're releasing our first version of our iPad that's been completely redesigned from the ground up, with our designer working full-time. And it really shows, there's a real difference in it. And I think that's what I got of Y Combinator, is having advisors like Paul Graham. They'll give you very blunt advice, but you'll absolutely listen to them and not fight them and say, no, our product's not ugly. No, we're growing fast enough. Because when they speak, you'll really listen and take it to heart, and they'll actually give you advice on how to implement their advice. And also just having, there were over 40 companies in the last YC batch, and the quality of the people in the program that you're working, kind of shoulder to shoulder with every week is incredibly high, and they just inspire you to work at your best level. And I've never really worked as hard as I have the last 4 months through the YC program and even afterwards. And it just really, when you're surrounded by really smart people who are working every day, it just becomes normal to work that hard and, expect really high performance.
Wow, that's really cool. Any, other than the obvious one of try hard to get into Y Combinator or something like it, any parting advice you have for other startups?
Sure. I mean, if they are interested in getting into Y Combinator, one of the magic elements of any startup is actually having more than one founder. And this is something a lot of people don't realize. So you find someone that you've known for several years that you trust. And that actually minimizes risk of both of the people walking away. And Y Combinator actually looks at that very closely and says, what's the likelihood of these people sticking it out, going through the hard times, working together, not walking away from each other? I mean, that right there is a huge, huge, valuable thing. You have these really two smart people that come together that are extremely brilliant, and they haven't known each other that long. There's a high risk that they'll just get upset with each other and the company won't work. So Y Combinator believes get the people that know each other very well. They don't have to be brilliant. Nobody has to be smart. They just have to be able to survive through anything, and the company will prosper. I mean, that's really part of what they see and what they look for in companies. So it minimizes risk for them going through the process.
That's very interesting to look at it from the perspective of an investor, to say how would my company look to an investor or to a program like YC. That's an interesting bit of detail. I think a lot of people probably haven't considered the value of the possible founders that they've known for years as much as that one special person they want to meet. So that's really interesting. Cool. Thank you for that.
I was going to give one other piece of advice, please. Just as a parting advice, is I would say the number one thing I've learned from working on drchrono the last 2.5 years is to never give up. I think as a startup founder, if you commit yourself and you will never give up and, will look failure in the face and realize what you're doing is not effective and pivot or change or evolve what you're doing and just stick at it, I think you're guaranteed to get a good level of success as long as you're self-aware and see yourself failing. And I have one secret piece of advice for people who are going into Y Combinator. And this is super secret, and I don't think anyone ever gave it out before. And I realized Paul Graham, whenever he talks to us, he calls us the chronos. And I think there's so many people in YC, he can't remember everyone's name. So if you pick a company name that lends itself to being kind of pluralized to address you as a group, I think you'll get a secret boost because he's like, great, I could just call these guys the chronos, and I don't have to remember their names. And that's my secret piece of advice with your company name.
That's fun. That's interesting. Thank you. All right. Michael, Daniel, thank you so much for spending time with us today. And we look forward to hearing more from you in the future. Continued good success.
Thank you.
That's great. Thank you so much, guys. We'll be back in 2 years to tell you about going public.
You can take us to your tropical island then.
Yeah, that's fair.
Okay.
And there'll be a Microsoft-based tablet version by then, we hope. So
Sounds good.
Sure.
Sounds good.
I'll let you know.
Great.
Thank you, Bob. Thank you, Patrick. Thank you so much.
Thank you, guys.
If you liked this show, check out some of our previous episodes at startupsuccesspodcast.com. Bob and I are here to help startups succeed. Bob offers a service called MicroConsult. You meet with Bob for an hour using Skype and a variety of online tools and come away with 8 or 10 actionable steps to take to improve your bottom line. Visit Bob's site, 47hats.com, to learn more. Microsoft has a program for software startups called BizSpark. If your startup is less than 3 years old and making less than $1 million in revenue, BizSpark gives you access to our premier development tools, server products for production, even Windows Azure with no upfront costs. Visit bizspark.com or email me at patrick.foley@microsoft.com to get started. That's our show. Thanks for listening. Tune in next week and be sure to visit our website for more episodes of the Startup Success Podcast with Bob Walsh and Patrick Foley.